Hi, I'm Kelly Cervantes, and this is Seizing Life, a biweekly podcast produced by Citizens United for Research in Epilepsy. Cure. Today, we continue our series of remotely recorded episodes during the COVID-19 pandemic by welcoming Alec Beauseigneur-Jimenez and his mother, Katie Beauseigneur, to the podcast. Alex is a former Marine who sustained injuries in a training accident in 2015. Following the accident, Alec underwent a series of operations to repair and regain use of his right hand. However, it wasn't until several months after the accident that Alec experienced the first indication that he had also sustained a traumatic brain injury resulting in PTE, or post-traumatic epilepsy. Alec and his mother are here today to talk about his injury, diagnosis, and living with PTE. Alec, Katie, thank you so much for joining us today and discussing your experiences with post-traumatic epilepsy and traumatic brain injuries. I have to admit personally that this was not a form of epilepsy that I knew much about until a couple of years ago when Cure was awarded a grant from the Department of the Defense to study post-traumatic epilepsy. I want to hear about how this all began for you, the training accident that caused your injury. Take us back to that day.
So my whole life, I always have been interested in the military. And so I joined the Marine Corps infantry. And in the infantry, they have sections. You have a rifleman, assaultman, and machine gunner. I went the mortarman. And essentially it is just a tube that shoots a rocket up and down. And on that day, we were out on a training accident and we just had a bad round. So as a mortarman, you load around in the tube, you drop it, and you duck your head below the muzzle so you get away from any explosives that happen above the muzzle. Unfortunately, I sat the round in the tube and I was waiting for the command to fire, but it prematurely went off. It cooked off in the tube is what we call it. And the only way for the pressure to release is up at the top. So I was still looking directly at the top of the muzzle and my fingers were there. So it knocked off my fingers and I got a huge round of concussive to my head, concussion.
Whew, that's a little terrifying, I can imagine. So what were the next hours and days like? I assume they rush you to the hospital, and what are you told about your injuries?
So I'll tell you, initially when it happened, we were on the big island of the Hawaii where our biggest mortar range happened. So I just remember sitting there. It was a nighttime operation. And again, I didn't hear the command to fire and the round went off. So I thought something bad happened. I just remember everybody, scattering, looking confused, don't know what was happening. I got the corpsman down. He threw a tourniquet on me pretty quickly, but we had to get everybody, an evac up to our site. And then once the evac brought me back to the main camp that we established, I had to hop on a helicopter over to the Kaneohe Bay where Tripler, the Army base, the medical base was. And I just remember, being confused, scattered around, not sure really what was going on. I remember looking down at my hand and just seeing red, so I thought the whole hand got knocked off. Thank God it's just a couple of my digits shortened a little bit. The next few days I was, surgery, so I was under a lot of anesthesia. I couldn't tell you what happened after the next few days. She can tell you on that one.
Well, and what happened quite quickly, Alec actually is even the one that phoned me. So I was in Florida. So within 24 hours, I was on the plane there. So I got to him pretty quickly. And like Alec said, a lot of surgeries, a lot of debridement, a lot of saving fingers, saving his thumb. But I think kind of what you're after is there was no real test and no real discussion about any brain head trauma.
Was there an MRI done? Any sort of brain scan? Did they discuss concussions, traumatic brain injury, post-traumatic epilepsy with you?
I definitely think, because again, my unit was still a lot of young guys. And there was, again, the main, just because it was so visual, my hand was the issue. There was no attention really directed towards my head. I don't think the story out on the field got written down, because, essentially you're supposed to duck below the muzzle where all the explosion comes from. So I think they thought I ducked below the muzzle, and again, no real attention was paid directed towards my head.
And I think that the immediate concern was his hand. It was really saving his hand. The extent of the damage, that was that was the mission. That was the goal when they got there, and the medical staff. But you would still think something like that. They know all possibilities. That let's check everything. So I don't recall ever them saying anything about an MRI. If they did one in the beginning, they didn't find anything, because I was with him for the next 20 days in the hospital. There was no MRI. There was no discussion about head trauma. It was really his hand. Mm-hmm. That was it.
Which was the visible injury. I mean, it's, you can see the logic in it. That's the visible one that's there. Unfortunately, this is, there's a track record of, it is difficult for people to understand epilepsy. It is difficult to treat because it is invisible, because we can't see this incredible injury. When did you have your first seizure?
It was a few months after the accident. The accident happened in May, and my first seizure happened in December, so pretty quickly after. But it really didn't show much attention. I just was driven to the hospital, kind of treated, and then sent back to the battalion that I was with.
Did they give you any explanation as to why you might have had the seizure?
Again, I was out at one of my friends at my battalion's house. We were having a few beers, just kicking back away from the Wounded Warrior Battalion, is where they relocated me to. Just the stress of being in that battalion. So I think they saw it more as, we were causing trouble, drinking away from the staff, and something went bad, and I just got directed to the hospital. It was more, they saw it as me doing something wrong instead of relating it back to my injury.
And he went by ambulance because his friend saw him. What we know now was a tonic-clonic seizure. He fell over. He had facial injuries, and I got the phone call from him. In the emergency room. I even remember speaking to the nurse. They had him handcuffed to the gurney because he was angry. And we know that when people have seizures, they get angry, they get confused. That's typical for Alec. We know that now. And it was described by the friends he was with. It was two people. They described that it looked like he had a seizure. They drug tested him. They did all these things and said, we don't see anything in his system. And they released him. And that was
it. They drug tested him, but they didn't do an MRI.
They didn't. Mm-hmm. And that was our first.
On top of that, too, I had a huge fat swollen lip because my face slammed into the ground. Again, no attention to any head injuries.
And it wasn't, I know that the people described it as a seizure, the people that he was with, and I just don't understand that piece. Looking back, I mean, I'm hindsight 2020. Knowing what I know now, but we can't go back. We can't go back because that doesn't exist. That day doesn't exist. But it definitely wasn't unfortunate. But that was seizure number one. Mm-hmm. That was that clinical signs that showed something major. I know just by looking back at that time, the confusion, his memory, he remembers not a lot of that time. We kind of had blamed it on the medication because he was on a lot of medication. I have to believe that, I really do believe that he was already having some seizures. We just didn't see them.
Hi, this is Brandon from Citizens United for Research in Epilepsy, or CURE. Epilepsy affects 3.4 million Americans. Learn more about cutting-edge epilepsy treatments and research at cureepilepsy.org. Now back to this episode of Seizing Life.
And then the next seizure happened, but it was quite a bit later. Tell us about that.
Okay, so that one, I was medically retired from the military. Just kind of now again restarting life essentially. It was definitely.
How many years have gone by at this point, or how much time?
About a year and a half.
Yeah, I think close to 2 years.
Okay.
And really just starting to get in a groove. I selected a college back out in Colorado, moving away from mom. After all this medical stuff, being released, that was a hard pill to swallow, being medically retired from the Marine Corps, because that's what I wanted to be in. So I picked a new career path. I'm motivated to get to Colorado, move into my place. We talked about, I just drove from Florida to Colorado with all my gear, moving into my apartment. My cousin came out to visit me, and we were in what they call Cave of the Winds. It's an attraction out in the mountains. And I had a seizure when we were doing a cave tour. And I just remember, I just think the load of stress that was happening at the time, the transition in life, still really kind of grinding my gears, a long drive. Mom says a lack of oxygen in the caves could have, sparked it. But it was in the Cave of the Winds during a cave tour.
But again, It was a tonic-clonic. It was a big one of those big seizures that you can't avoid. You see them, they're happening. And I continue the position that had I known what to look for, I know that he was having more than just these big ones. These big events were just presenting, but I know what I know now about seizures and specifically Alec. There were other things present, but I just didn't know. We didn't know what they were to even identify those things at the time.
Yeah, I absolutely. And so you have this second seizure a year and a half or so later, the second tonic-clonic, we'll say, because there could have been likely seizures happening in between and you just didn't know that that's what they were. At that point, an MRI is done and you are diagnosed. Is that correct?
At that point, they referred me to a neurologist out in Colorado. So that was the first time I got really attention towards my head. I'm now in with the neurologist, and she starts me on a light prescription of Keppra. So now they're thinking, I'm having seizures. I don't think I was diagnosed specifically at that point with epilepsy, but from then on, my epilepsy really started ramping up. I was having, the tonic-clonics, grand mals. And we started gaining the knowledge of what we know now, that, hey, this is a really big problem. We need to, give it more of a focus and treat it as a bigger problem. So I started getting prescribed medication, and we just started testing out a lot of different things.
Unfortunately, there's all of these studies that have been done that show that sort of once those floodgates open, it is very difficult to regain some semblance of control. It's much easier to plateau or maintain the control or lack thereof that you have, but regaining that is that much more difficult. Do you have seizure control today?
Seizure control is, hard to say. Yes, I do in various points, but you just never know when one of those puppies sneak up and wants to mess up your day. I do, for the most part, have seizure control with the medication I'm on. I did just get the deep brain stimulator surgery.
Tell us about that a little bit.
Yeah, so ultimately, I talked with my first neurologist. She had presented me the idea of the vagus nerve stimulator and the deep brain stimulator. I was more interested in the deep brain stimulator. So from then on to this point, I've been kind of seeking that as my end goal, what's going to kind of help me out. Now that it's implanted, I don't have it turned on yet, so I don't have much information on that. Besides the surgery, they give you a sweet couple of haircuts. They implant the probes up here, and then they put the generator in your chest.
Similar to a VNS, but
Yes.
From my understanding, it is more directly implanted on the brain versus the vagus nerve.
Mm-hmm.
And you don't get to a brain stimulator though without going through the medication trial and errors. I think one of the goals was really to find that focal point and to possibly remove that part. And hopefully the goal was really to be seizure free. I mean, that's what we all want. Mm-hmm. But all the tests we did and just the rapid increase of seizures that really changed his life and debilitated him. We actually got it over to the Epilepsy Center in Tampa and started doing inpatient EEGs. That's where we found there were stuff coming from both sides. And then that led to the SEEG, which is the invasive, where they drilled 9 holes and put the probes in, and he was in the hospital for 10 days to really get a solid understanding of what was happening. That's when we really learned that he wasn't a candidate for finding that focal point, because there's 2 of them. It's on both sides. And the amount of seizures he was having, I think they got 60 in 6 days, but he was still on a heavy dose of medication because they slowly take him off. And that's when they decided that the deep brain stimulator at this time was the best therapy for him, in addition to his medication.
Right. You mentioned that, the seizures were coming from both sides of the brain at this point. Were they able to find or see some type of brain injury in the scans?
Yeah, with my epileptologist, when I got my first real big MRI focused on trying to find a problem in my brain, I do have a lesion that we believe came from the accident. It's up in my right hippocampus area, and it did show signs of a lesion that was just never focused on at the very beginning.
And that was one of the things that the target area, I guess, they were really focusing on, because when you saw that lesion, that's a hard thing to see in your brain, just a gap. They were just hoping that may have been the center, the source. But it proved not to be, which is kind of interesting. It just proved not to be. They weren't even coming from that area, even though that definitely there's brain damage there. There's definitely some damage there around that area. And we'll never know where that came from, because, I've always said this about Alec too, with all the seizures that he was having, I believe he could have even sustained more head traumas with the amount of times that he's gone down and not been seizure control. He has had some other injuries to his head, which they're alarming and they're scary, when you live a life with seizures.
Yeah, absolutely. I think you touch on a really important piece here that I want to dig into a little bit more, and that is, how have the seizures affected your life? You talk about, more seizures brings more damage, brings more negative effects and impacts on your life. For those that may not understand what that actually looks like, can you tell us or give us some examples of how it has impacted your life?
One big thing that I do want to put out to whoever watches this is, I like to be a very independent person, and I do have a support team, but I don't ever really want to lie into their hands too much. But there's been multiple times where, I've come off a medication out of frustration when at the very beginning, when stuff was ramping up, and I would just go off and try to be away, thinking that moving or changing my locations is what's going to solve the issue. And I end up in a hospital, not knowing where I'm at. And my mom has to come. You can't do this alone. It does definitely bring on some dark days. You can't go after certain things that you thought you wanted to. You have to take a slower pace at things, but everything is achievable just at the right speeds, and with the right support system, and relying on your team, essentially.
Now, we are beyond grateful that you are speaking with us today about your journey, but have you always been this open about your epilepsy and the seizures, or is this something that you have hidden in the past?
Oh, for sure. I've hidden from a lot of people, and still to this day. I was a server at Dave & Buster's when I moved out to Colorado, just getting extra change in, going to college. I would go wait tables after school. And when something felt off, I would duck into bathrooms, kind of have, seizures in the bathrooms, and then come back out and finish the shift, because I didn't want people to see me struggling or even have a seizure out in front of everybody else.
First of all, you are amazing and so incredibly strong and resilient, and that story gives me absolute chills. But it also makes me incredibly sad that you were in a bathroom stall at a restaurant having seizures while on your shift, and then would go out and continue. And I can't imagine being in that position, and it makes me equally impressed and just so sad and frustrated at the same time.
And just to talk a little bit about the supports, I mean, there would be so many times he would call me. He was in Colorado, I was in Florida, and he would call me from these stalls, "Mom, I'm in the bathroom again," and talking through and figuring out how to, his calming mechanisms. He's had a lot of practice in calming his body to do those things, but there's been a lot of calls from bathrooms, more than I probably care to admit.
And what is your advice for other parents in your position where you're getting those calls and you're thousands of miles away and you seem so calm about it? But I mean, I know it's terrifying watching your child or hearing about a seizure that your child had and feeling so helpless. How have you remained calm? How have you recognized and balanced independence versus wanting to take care of your baby?
Well,
and meanwhile, I know that you are a grown man, but to a mother, you are always your mom's baby.
That's very true. I think early on, I just didn't even really know it. I think we were in such go mode. At the time, I feel like there was just crisis after crisis after crisis. Ambulance, then it was calls from the bathroom, then it was, those were some of the dark days, and we had them with the hand accident, and fast forward 2 years, we're on a different crisis mode. I think we were just really in go mode, trying to really figure things out, especially me. But ultimately that led to him coming home. Mom, I can't be here anymore. He couldn't live independently, to where he had to come home, which was easier than being thousands of miles away, I'll tell you. But we're very new in this community. We've spent all of 2018 really just discovering his seizures. 2019 is where we've really just been doing all of the testing and hospitalization to this point. But, as a parent, I've had to sit back and show up when he needed me in big ways, big ways. And I think for any parent dealing with epilepsy is helping them gauge this, because I had to show up, but then I also have to step away, because independence for him is huge. This is a 25, almost 26-year-old guy that was in the military, and moving home with your mom is hard, So that's really, for me, just watching that, engaging that, and helping him when I see things that he may not recognize too, is pointing them out. Hey, are you feeling okay? And just being really just supportive and knowing what my role is, to step up, step back, to allow him to grow and be independent as he can at this point in his life, which is important.
And that just goes back to, you have to be truthful with your support groups, because I definitely would keep a lot of information away from my mom, because I just wanted to be, I wanted to be proud of me independently. And, I would have seizures, call her after or call her before seizures. I could gauge what types were coming on at that point. But you just have to be open and truthful, because ultimately, when you're unconscious and nobody's there around, doesn't know what's happening to you, they're going to get the call as my emergency contact number, and she's got to be fed the whole story, know what's happening, make sure people are timing it, places that I'm at, and all that.
Yeah, communication is integral. unless you have that support team, unless you have that seizure action plan in place, you're just putting yourself at greater risk. I think that's really incredible advice. And tell us about what you're doing now.
I still want to use my post 9/11 bill for school, but at this point in time, it's just not smart because my memory is horrible, and I don't want to waste that on a degree and not remember anything that I did. So again, we're leading up to this point where I have the deep brain stimulator implanted and see how that kind of affects me, and then go on and achieve those goals.
When you're able to start school, what is it that you would like to study?
I'm going back in the college that I was out in Colorado was aviation electronics, and then that's what I'll go back towards when I go back to school.
Amazing. Well, we wish you the best of luck with that. Alec, Katie, thank you so much for sharing your story with us. Alec, thank you for your service, and I'm sorry that this was the crappy club that you had to enter following that one. But I hope that you know that you are in incredible company, and we fully support you, and hope that I get an email one day telling about your graduation and moving on into aviation. I can't wait to read all about it.
All right. Thank you for having us.
Thank you, Kelly.
Thank you, Alex and Katie, for sharing your experience battling post-traumatic epilepsy. Cure understands that epilepsy can strike anyone at any time without warning. 1 in 26 Americans will develop epilepsy in their lifetime, and the cause can vary from genetics to illness to infection to traumatic brain injury, and some never know the cause for their epilepsy. That is why Cure is dedicated to funding patient-focused research that will bring us new knowledge, therapies, and cures. Now more than ever, we need your help to pursue our mission. Please visit cureepilepsy.org/donate. Your support and generosity are greatly appreciated. Thank you.